Hey everyone, and welcome to this explainer. I am absolutely thrilled to have you here. Today we're diving into Module 2, Assessment and Screening Communication. We're going to focus specifically on the English vocabulary and the exact communication tools doctors use to identify addiction. We'll be unpacking some really important medical acronyms, and I promise by the end of this, you're going to have a fantastic toolkit of new vocabulary ready to go.
Okay, let's take a super quick look at our roadmap for today. We'll start with what screening tools actually are, then move on to the CAGE questionnaire, SBIRT, and the 5A strategy. After looking at some specialized tests, we'll wrap up with 2 rounds of vocabulary practice to really lock it all in.
So, Section 1. What are screening tools? Basically, opening the medical toolkit.
Imagine you're a doctor, right? You're opening up your medical bag, and the very first things you need aren't just a stethoscope and bandages, but tools to actually understand your patient. So, how do doctors identify addiction? Well, think about how tough it can be for a doctor to bring up really sensitive topics like alcohol or drug use, especially with a brand new patient. It's incredibly personal, and patients might feel kind of embarrassed or even defensive. So the doctor absolutely needs a way to ask about these habits safely and professionally.
And that brings us to our first major concept. A screening tool is simply a quick test. Usually, it's just a short set of questions used by health professionals to find out if a person has a problem with alcohol or drugs. Think of it as a standardized way to ask all the right questions without sounding judgmental at all. It just helps the doctor gather the facts quickly, so they can decide if the patient needs some extra help.
All right, moving right along to Section 2, the CAGE questionnaire. 4 simple questions.
Now this is a real game changer. This easy-to-remember acronym is a very famous tool used all over the world for screening alcohol use. Let's break down what each letter in CAGE stands for. And hey, pay close attention to the bold words here because they're going to help lock this vocabulary into your memory. Okay, so C stands for cut down. Have you ever felt you should cut down on your drinking? A stands for angry. Have people made you angry by criticizing your drinking? G is for guilty. Have you ever felt bad or guilty about your drug use? And finally, E stands for eye-opener. Have you ever needed a drink first thing in the morning? 4 simple letters, 4 incredibly powerful questions.
Next up, Section 3, SBIRT and the 5A strategy. These are the actual steps to help.
So, once a doctor asks those initial screening questions, what happens next, right? Well, that's where SBIRT and the 5A strategy come in. They give doctors a super clear step-by-step plan for action. Our next big vocabulary word is SBIRT. That stands for screening, brief intervention, and referral to treatment. Now, let's break those big words down into everyday language. We already know screening means testing. Intervention? Well, that just means stepping in to help or giving some advice. And referral means sending the patient to a specific expert or a clinic. So, putting it all together, SBIRT is an evidence-based practice where a doctor tests the patient, gives them a brief piece of helpful advice, and then, if needed, sends them to the right experts for more care.
Now, another brilliant way to handle these brief interventions is what we call the 5A strategy. This acts like a timeline of action for the doctor, literally from the moment they say hello. First, they ask about substance use. Second, they assess the pattern and the problems it might be causing. Third, they give clear advice to stop or cut down. Fourth, they assist by providing specific help or resources. And fifth, they arrange follow-up appointments to check back in on the patient. So that's ask, assess, advice, assist, arrange. Very logical, right?
Okay, on to Section 4, 5 specialized assessment tests. These are our tools for specific substances.
Sometimes, those basic tools just aren't enough, and a doctor needs a much more specific tool for a specific problem. So the key takeaway here is to match the abbreviation on the left with the specific target substance on the right. Let's look at the first one. AUD is used specifically for alcohol. Next is DAST, which stands for Drug Abuse Screening Test, so yep, that one is for drugs. Then we have MAST, which targets alcohol-related disabilities. After that is FTND, and that's a very specific test for nicotine, meaning smoking or tobacco use. And finally, ASSIST. That's a really broad test created by the World Health Organization, and it covers all substances.
All right, it's time for Section 5, Vocab Practice Round 1. Let's check your memory.
You've absorbed a ton of great medical vocabulary so far, so now it's your turn to put it to use. We're going to do a really quick flashcard quiz just to test what you've learned. Honestly, don't stress about it. Just do your best to recall the words. Ready? Let's kick off round 1. Here's your first challenge. What do the C and the E in the SAGE questionnaire stand for? Take a second to think about it. I'll give you a tiny hint. The C is an action you take to reduce something, and the E is something that happens literally first thing in the morning.
Okay, did you get it? C stands for cut down, as in feeling the need to cut down on drinking. And E stands for eye-opener, meaning needing a drink first thing in the morning. Fantastic job if you remembered those. Awesome. Moving on to question number 2. What are the 3 main parts of the SBIRT acronym? Remember, this is that step-by-step process a doctor uses to test a patient, give them some quick advice, and then send them to an expert.
And here are the answers. SBIRT stands for screening, brief intervention, and referral to treatment. These 3 steps are so crucial because they safely guide the patient from their very first test all the way to getting the specialized help they need to recover.
All right, last question for round 1. Which specialized test is used to check for nicotine dependence? Just remember, this is the specific test for people who smoke tobacco. Hint time, the acronym starts with the letter F.
The answer is FTND. That stands for the Fagerstrom test for nicotine dependence. Let's actually practice saying those letters out loud together for pronunciation, okay? FTND. Try it one more time with me. FTND. Excellent work.
Let's jump into Section 6, Vocab Practice, Round 2. Faster this time. Okay, you did absolutely great in Round 1. You're really getting the hang of this medical vocabulary. So, let's dial up the speed. We want to really lock this vocabulary into your brain so it stays there for good. Ready? First up, can you name the steps in the 5 A's strategy? Just shout out as many of those 5 A words as you can remember. Remember, they describe the timeline of a doctor's conversation. Go.
Let's see how many you got. The 5 A's are ask, assess, advice, assist, and arrange. Listen to the rhythm of the words as I say them again. Ask, assess, advice, assist, arrange. Beautiful. Here is your final matching puzzle for this explainer. Let's see if you can fill in the blanks. Audit is a test for what substance, and DAST is a test for what substance. Try to separate the alcohol test from the drug test in your mind.
And here are the final answers. Audit is for alcohol, and DAST is for drugs. A great little trick is to use the first letter of each acronym to help you remember. So, A for audit and alcohol, D for DAST and drugs. Seriously, I am incredibly proud of your hard work and focus today. You've just mastered some genuinely complex vocabulary.
Before we wrap up, I want to leave you with a thought to chew on. How could simply using the right screening tool change a patient's entire life? We practiced words like CAGE and SBIRT today, and sure, they might just seem like standard vocabulary words to memorize right now, but in the real world, these are literally life-saving tools. They let doctors start difficult conversations, offer help without judgment, and ultimately save lives every single day. Keep practicing your English, keep up the amazing work, and I will see you in the next explainer.